MediGroup Physician Services presents MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Wanda Bax, Field Vice President GPO Sales for McKesson Medical Surgical Inc. Now here's your host, MediGroup's Frank Gillespie.
Well, hello and welcome to another edition of MediGroup's Frank's Fast Five. Today, I have the special honor of talking with an executive that I've had the pleasure to work alongside with in a previous couple of lives, and also someone whom I consider a very good friend and a very special person. Wanda Bax is here from McKesson Medical Surgical. Wanda is the Field Vice President, GPO Sales for McKesson. Wanda, it is truly an honor and welcome.
Thank you, Frank. It's an honor for me to be here. I appreciate you reaching out.
Absolutely. Thank you so much. And I appreciate your time. I know you're a very busy lady. So thank you. I promised you I wouldn't waste your time. So if it's okay with you, I'm just going to dive right into these questions.
Perfect.
Okay, thanks. So Wanda, could you share a bit about your experience in the healthcare industry, various roles you've had up until today?
Absolutely. Looking back, Frank, I actually began my healthcare career right here at McKesson years ago. I worked in field sales in the extended care market, calling on long-term care facilities, covered part of Missouri and Southern Illinois. And that was truly a humbling experience, serving that segment of our population. It was an honor, honestly. Then I moved on a few years later and became a national account manager for Major Pharmaceuticals, which is a generic pharmaceutical company. And in that role, I was a national account manager over institutional sales, calling on large hospitals, Department of Defense, correctional facilities. And then through those two roles, I learned and became more familiar with GPOs and in the healthcare. And so my next step in my career was taking a director role to cover non-acute contracting for MedAssets, a large GPO at the time.
Yes.
And then that kind of launched me into over to Amerinet, also later rebranded as Intelair, as a program manager. And I worked there then for a number of years until I found myself here back at McKesson.
Awesome. You've come full circle and you've done tremendously well. And hence our past lives, MedAssets
Yes.
and Intelair. And it's where we got to know one another and enjoyed every minute of time getting to work with you. Truly a pleasure to work with you. Thank you.
Thank you.
And also your background in long-term care as you got started. When I worked for Daughters of Charity National Health System, that was one of my primary roles, was calling on the Little Sisters of the Poor nursing home. So
that's
very special place in my heart for those folks as well. So
agree.
Awesome. That's very nice. So Wanda, question number 2, so our viewers know a little bit more about what is your role today with McKesson.
Sure. So as Field Vice President for GPO sales, I have responsibility to manage a GPO, and namely Vizient. I manage the relationship. I negotiate the contract. I manage the contract to ensure contract compliance, that we're doing everything we're promised to do. And as well as work with leaders at the Vizient organization to drive strategy and work to make sure that we're both growing and serving our mutual customers the best we can. As part of that role, I'm also working directly with the channel partners that fall beneath Vizient and do the same for them. So it's a great role. I have opportunity to work with some great people and enjoy every single day.
And I'm absolutely sure they enjoy working with you. I know our team at MediGroup loves the opportunity and the experience, and I say that sincerely. So it's great to have somebody like you to work with.
Feelings mutual.
Thank you, Wanda. Question number 3, how have the experiences you've had working in the GPO world positively influenced your approach into your current role?
Having worked at the GPO in that particular level, it has helped me to gain insight as to how the GPO really helps to serve the healthcare providers, which are their members, providing improved cost, and services that they're able to provide to help the providers, the ease of doing business as well as serving their patients. This has also helped me today in my role with educating McKesson field sales teams on how to partner best with the GPO in support of their customer base, because the GPO can be truly a partner. They should be pulling in their GPO reps and showing that collaboration and working together on behalf of the customer overall. It's really become evident and really came full circle during the pandemic, when we were both truly working the hardest we could to provide the products that our customers needed, that our providers needed. And I think the partnerships that we had is what really made us successful through that time.
Fantastic. And we experienced that from McKesson as well in our working relationship at MediGroup. So truly, you played an integral part, not only with us, but absolutely with the other GPOs as well. So fantastic.
Thank you.
Absolutely. Question number 4, we're just rolling right along here. Are there any new practices you're seeing happening from a procurement standpoint within the non-acute care space?
Well, probably no surprise to y'all. Customers are really, really paying attention to the cost of things. And it is like more now than ever. And in fact, many have reached outside to hire consultants to come in and take a look at their operations, their procurement practices, the costs of doing business, what they're paying for products. They're guiding them through RFPs to look at GPO partners. Is the partner that they're currently with the right one, or consider alternatives? And doing the same on the distribution level too. The distributors, they're looking at us as well. And this has truly become more of a practice, especially in those situations where private equity has come in and made acquisitions of these practices, and they're wanting to definitely show value and savings and drive the costs down. So it's been something we've seen a lot here lately, I'd say the last few months, and there's no slowing down. We're seeing new RFPs coming in the door every single week.
Wow, that's challenging for sure. And
it is.
certainly, I mean, in my entire career, as I'm sure with yours as well, cost has always been something that's important,
Yes.
but it's magnified even more so today with what's going on in the economy and everything else. And perhaps it was the same years ago with what was going on, but it just seems bigger today for a myriad of reasons, I'm sure. So you guys are approaching. Yes.
And just a couple of years ago, even up to a year ago, just getting product was top of mind.
Absolutely.
Now we're back to really drilling down on the cost and making sure they're getting the best deal. And I understand it. But we don't want to compromise patient care in the process.
No, absolutely. Absolutely. Well, Wanda, great answers and great responses, and I really appreciate it. The last question I have for you is, what is your favorite hobby for you? What do you like to do for fun?
I just like to have fun, Frankie. You know that.
There's no question about that.
I love my family, love my 5 grandbabies. My grandchildren, love to spend time with them. Summers are fun, spent at the lake. We enjoy that with friends and family. But close to home, my husband and I enjoy being outdoors, entertaining, gardening, just, kind of enjoying this season of our life.
Absolutely. Well, all season person for sure. And I know you've always been close to your family and to your grandbabies as well. And you just shared with me before you started, you've got grandbaby number 5, and that's just awesome. Congratulations on that.
Thank you. Thank you.
You bet. Well, Wanda, I told you it would go pretty quickly, and it did. But it did. Very informative and honest to goodness, just a honest pleasure just to get to talk to you again. I don't get to see you as much these days. So thank you again, and please stay in touch.
Likewise, Frankie. Thank you so much.
Thank you
Appreciate the
too.
opportunity.
I appreciate you saying yes. Thanks so much. Take care of yourself.
All righty. You too.
Okay, thank you. Bye-bye.
Bye.
This has been MediGroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Wanda Bax, Field Vice President, GPO Sales for McKesson Medical Surgical, Inc. This has been a presentation of MediGroup Physician Services.